Hey everyone, Luke here with the Knee Replacement Therapist. In this episode of the Need to Know Show, we're going to talk about pain at night after knee replacement surgery, and I'm going to provide you some tips to help manage that pain and sleep better and feel better. Before I jump into that, be sure to hit that subscribe button, turn on the notifications to catch all of our latest videos. So I'm sure, when it comes to knee replacement, rehab, and recovery, you're exhausted, your knee aches, you're in pain and discomfort, and all you want to do is lie down and fall asleep. But the pain, the discomfort, the tossing and turning, you just can't fall asleep. So what do we do about that? Well, first, why does this happen? One is at night you are not moving like you do during the day. So you're lying there flat, not really moving, and what can happen is fluid and swelling. So you can accumulate some fluid, some pooling of fluid in and around the knee joint. And this can lead to that achiness, that discomfort that you might feel when you're lying in bed at night. Another thing is when you're lying still is stiffness. So you develop stiffness. You're not getting that blood flow. You're not getting that fluid movement. So you're going to develop some stiffness in the knee joint as well. Another thing is just you have fewer distractions. So you're lying there in bed, you're not talking to someone, you're not watching TV, you're not participating in some activity, you're just lying there trying to fall asleep. And I'm sure many of you have experienced this when the harder you try to fall asleep, the more difficult it becomes. And that's the same thing happens when you're having difficulty falling asleep because of knee pain and discomfort. And then just positioning. So, the leg might not tolerate certain positions. It might not feel supported and comfortable in certain positions. And it can be tricky to find what the best position is to fall asleep effectively. So these are all very common. It's definitely something that gets better with time. But we want it to be better as soon as possible, I'm sure. So here are some tips to help with this pain at night. So one, like I said, is positioning. So pillows and props. So pillows, such as just regular pillows or like the full body length pillows, using things such as wedges, can be very helpful to position yourself and feel more comfortable to sleep at night. So propping a pillow under your knee. So we want the pillow, we can prop it lengthwise. So what I mean, we don't want it directly under the knee where the knee is bent in a bent position for a long duration throughout the night. But we can put the pillow lengthwise, kind of under your calf and your thigh to provide a little bit of support to the knee throughout the night when you're sleeping. Some other things you can do is try laying on your side. Lay on your side and put that pillow between your legs to keep your pelvis and hips and legs in a more neutral position. And that laying on your side, either with the surgical leg up or the surgical leg on the bottom, can provide some support to the knee as you sleep as well. And you can also just use the pillows or use a wedge to elevate the leg up, and that may help reduce some of that swelling that occurs and some of that pooling of fluid that occurs throughout the night. Another things to think about is what are you doing in the evening before you go to bed? So what we want to do is one is get on top of your pain. So that might include taking pain medicine 20 to 30 minutes before going to bed, icing the knee, doing some gentle massage, range of motion and stretches to the knee joint and to the muscles and soft tissue around the knee, doing everything we can to kind of reduce that stiffness, let the muscles and tissue around the knee feel relaxed and calm as you're getting ready to fall asleep. The most difficult part usually is falling asleep, and once you're asleep, typically you can sleep a fairly good duration, hopefully. You may wake up in the middle of the night still, but usually it's falling asleep is the biggest difficulty. So get the pain as much under control, get that stiffness and discomfort as much under control as we can through those variety of techniques, and hopefully that will help you fall asleep easier once you're laying in bed. And just other pain management strategies. So that might be use of compression wraps. It might be use of electrical stimulation or TENS. Talk to your doctor, talk to your physical therapist about ways to manage pain effectively to help you fall asleep and stay asleep better. And in general, we just want to think about good sleep hygiene that anyone would think of and anyone can use to sleep better, right? We want to give ourselves as much benefit and as much of a chance to sleep well as we can. So just thinking of normal sleep hygiene tips. So, sleeping in a very dark, it should be completely dark in your room. We should avoid screens and, avoid looking at your phone, looking at screens 20 to 30 minutes before going to bed. You want your room to be at a nice cool temperature and quiet, not a lot of noise or distractions. So remembering that good sleep hygiene. Another one is, trying to go to bed and wake up at the same time every day can be really good to develop that sleep habit. So those are just some tips to hopefully help deal with and manage that night pain that comes with knee replacement, rehab, and recovery. Again, for the vast majority of folks, this is temporary. It does get better over time, but these are just some tips to manage it and deal with it while you have this issue. I hope you found this helpful. Please be sure to hit that like button. Please be sure to leave your questions, your comments below. Thank you for watching.